Prostate cancer is one of the most common cancers in men around the world, which brings up important questions about where it comes from and what makes people more likely to get it. Is prostate cancer passed down through families? Is a very important question. Researching the DNA factors that put people at higher risk for this disease is very important because it can change how people are screened, treated, and prevented. Knowing that genes play a big role in how likely it is that a man will get prostate cancer can help him make smart decisions about his health. Watch the video to learn more about how men can get prostate cancer and what that means for them today. Understanding prostate cancer. The prostate gland, which is a small gland in men that looks like a walnut and makes seminal fluid, is where prostate cancer starts. Several major risk factors have a big effect on this type of cancer. Most cases happen in guys 65 years of age or older, so age is the most important factor. Race is also very important. For example, African American men are more likely to get it than men of other races. Also, things you do in your daily life, like what you eat, how active you are, and how much you are exposed to certain chemicals, can affect your risk of getting prostate cancer. And to find problems early and stop them, it's important to know about these risk factors. If you want to know about the complete signs of prostate cancer, then go to the link in the description and watch our complete video. Genetic factors. People who have genes that cause cancer can pass it on to their children and grandchildren. For example, genes like BRCA1 and BRCA2 make it much more likely that you will get prostate cancer later on. Women with these genes are more likely to get breast and ovarian cancer, but men with these genes may also be more likely to get prostate cancer. About 5% to 10% of cases of prostate cancer are thought to be inherited, which means that the person has a strong genetic tendency to get the disease. If you have these genes, you may have a higher chance of getting prostate cancer. You should talk to your doctor about genetic tests. This knowledge can be very important for early detection and maybe even better health control. Family history and risk. If someone in your family has had prostate cancer, you have a much higher chance of getting it yourself. Men who have a family member who has had prostate cancer are twice as likely to get it themselves. It's even more important for you to keep up with screenings and appointments with your doctor if your father or brother has been identified with prostate cancer. In addition, if you have a family history of other cancers, like breast or ovarian cancer, that are linked to BRCA1 or BRCA2 gene mutations, this could make your chance even higher. If you want to reduce the risk of prostate cancer, then go to the link in the description and watch our complete video. Genetic testing. Genetic testing is very important for figuring out the risk of getting prostate cancer because it finds specific genetic changes that are linked to the disease. People who have a strong family history of prostate cancer or cancers linked to it should get this test. DNA from a blood or spit sample is used to look for changes in genes like BRCA1, BRCA2, and others that are linked to a higher risk of getting cancer. The results of these tests not only tell you about your own risk, but they may also have big effects on your family members because they may have the same genetic differences. Knowing about these genetic markers can help family members who are at risk for health problems find them early and take steps to protect their health. Managing hereditary risk. Managing the inherited risk of prostate cancer requires keeping an eye on your health and making changes to your lifestyle. People who have a higher genetic risk should get regular checks like PSA tests, and maybe even MRI scans to make sure they find cancer early. Making changes to your lifestyle, like eating more fruits and vegetables, getting regular exercise, and cutting back on processed and red meats, can also help lower this chance. Additionally, it might be helpful to talk to a doctor about preventive treatments, such as medicines like chemoprevention drugs. The goal of these actions is to lower the risk of getting cancer, giving people with a higher genetic risk an extra layer of safety. Prostate cancer is a big problem for men all over the world, and finding out if it runs in families is important for effective prevention and treatment. For people whose family has a history of prostate cancer or cancers linked to it, genetic testing can be very helpful. Genes like BRCA1 and BRCA2 can raise the risk. It is thought that between 5 and 10% of cases of prostate cancer are passed down through families. This shows how important genetic factors are in figuring out risk. Key ways to deal with hereditary risk are regular tests, changes to your lifestyle, and maybe even preventive treatments. By taking these steps, the disease might be found earlier and the risk of getting prostate cancer may go down. Remember to subscribe, share, and comment so you can always see our newest videos.